Hello, and welcome to the Art of Being Human. What we have been talking about is hypoglycemia, and I want to continue with that today because I didn't quite finish with it. I got considerably a lot of work done with it, but not quite enough. So I want to go back to hypoglycemia. I want to review with you the fact that in hypoglycemia, you do not have enough, you have too much insulin, and the problem with that is that your blood sugar runs completely low, and you have to keep checking yourself and getting it up and getting it up and getting it up. It is a disease in its own right, but it also acts as a precursor to diabetes. So some people have a period of years or so when they have hypoglycemia, and then they get diabetes after that, because what happens is their insulin is too much, they are producing too much insulin, and they get to the point where the pancreas can't do it anymore, and it starts to shut down. Now you can take any number of series of pills that force it to do more insulin, and that's all right for a while, but then after a while it just comes to its end when it just can't do it anymore, and then your blood sugar really rises rapidly, and you become basically a type 1 diabetic. So you have to remember there are those extremes: hyperglycemia, which you have too much blood sugar, and hypoglycemia, in which you do not have enough. So I'm going to look at these charts and just help you with these charts. I did mention to you hypoglycemic unawareness. In hypoglycemic unawareness, you don't realize that your blood sugar is dangerously low, and you don't have the symptoms that it's dangerously low. So what happens is that you're doing your normal things, and suddenly you collapse. There is a story about a coach. He was either a coach of a baseball team or an umpire in a baseball team. Now, this is a national team. This isn't like a town team or something like that. It was a nationally recognized team. And he was doing what he needed to do, and then he suddenly collapsed. And what happened was he was wearing an insulin pump. And when he wore the insulin pump, for some reason it malfunctioned, and it was giving him too much insulin. And he didn't understand that. He didn't have any symptoms to indicate that he was getting too much insulin. And so he finally just collapsed and went into a kind of coma. With diabetes, you can go into a coma if your blood sugar is too high. You can go into a coma if your blood sugar is too low. In his case, it was too low because he was wearing a pump that malfunctioned. Now, every so often, I have a doctor ask me if I would like to start using a pump, but I always say no, because I've known of cases where it has malfunctioned and a person has been in very serious condition because they couldn't stop it from giving it too much insulin. The other thing is, I think you have to program them exactly so that you don't have to test, you don't have to do anything in terms of how much insulin you take. Well, you do have to test, but it will give you a supply of insulin as you have programmed it to. Well, what if your schedule changes? What if instead of eating dinner at 6, you decide to eat it at 7? What if you're busy, and things get out of hand? You have to be very, very precise with an insulin pump. And my life isn't that precise. I can't make it that precise. So I stay away from the pumps, but I'm not trying to get you to stay away from the pumps, because I know a lot of people that have marvelous results from it, and they wouldn't be without them, and it's the best for them. For me, with my schedule, as varied as it is, I don't want to rely upon a pump because I'm afraid I would program it incorrectly. The other thing is that pumps are extremely expensive. You can pay $5,000 for a pump. And if you're type 1, Medicare will cover for it, or cover a good part of it. But if you're type 2, until recently, type 2s would have no Medicare coverage for a pump. You had to be type 1. So that has changed. It's changed a little for the better. Nonetheless, I myself stay away from the pumps. So let's take a look at this. When you don't realize that your blood sugar is dangerously low, that's called hypoglycemic unawareness, and it's common in pregnant women, and you have to check your blood sugar very often to make sure it's high enough. Always test your blood sugar before you drive, and always check it before you exercise, because exercising will lower your blood sugar, so it needs to be checked. Now, you can take fast-acting sugar if you are hypoglycemic. I'm going to give you a list of things that you can take if you are too low. And these are some things. What they tell you is take enough to get 15 grams of sugar in you, or 15 grams of sweetener, fruits or whatever, and then wait 15 minutes and check again to see if you're still too low. I know if you have severe symptoms, when you have had hypoglycemic episodes before, you get to know what your symptoms are, if you have symptoms at all, and you don't have hypoglycemic unawareness, so you can judge in some way how low you are. But this is what you would take. 3 to 5 glucose tablets. I've had glucose tablets in here before. 2 tablespoons of raisins, 1/2 can of regular soda, 4 ounces of orange juice, 5 to 7 lifesavers. I think lifesavers are a little slow. The juices, I think, get into your system faster. 3 pieces of hard candy. Here again, you've got to suck on them before you get them into your system. Juices are faster. 6 jelly beans, 10 gumdrops, 6 to 8 ounces of milk, or a large teaspoon of sugar. That seems kind of gross. But anyway, those things should raise your blood sugar enough by 15 grams. And when you have it by 15 grams, you'll start to feel better. And then what you need to do is keep rechecking. And if you need to do it again, you do it again. Now, there is also something called the dawn phenomena. It's in the morning your blood sugar raises really high. And that's usually from 4 to 8 o'clock in the morning. And what happens is that your blood sugar may be a little low, and your liver decides it needs to have more sugar in it. And so your liver that stores sugar and other things will start pumping sugar into your system, but it does not know when to stop. It doesn't know because the pancreas, the insulin from the pancreas would normally stop it. It can't because the insulin is not there, and so it just keeps pumping and pumping and pumping. Now, eventually it stops, but you can get very, very high blood sugar. There's also something called ketoacidosis, diabetic ketoacidosis, abbreviated DKA. This is always an emergency. And if you have ketones in your urine, and the way to test for it, there is a urine test that you can take, and you give a sample of urine, and then you put a kind of a tag, a paper in it, and it'll register whether you have ketones or not. It's always an emergency. If you have ketones in your urine, then you must contact your healthcare professional immediately, or go to an emergency room, because it can send you into coma, it can send you in a shock situation. But what's happening is this: when you do not get enough insulin, then the sugar does not get into the cells. It is the insulin that gets the sugar back into the cells so that they can function. But if you don't have enough insulin to do this, then you're not going to be able to get your muscles supplied with the sugar that they need to function. So what do? They break down fat. When they break down fat, they use that for energy, but the byproducts of that process are ketones, and you can check them in your urine. And as I said, it's always an emergency. The symptoms of having ketoacidosis are these. You can go into coma, you can go into shock, you can get pneumonia from it, you can have problems in breathing. It's especially difficult for small children, prevalent in small children, and it can eventually lead to death. So ketoacidosis is usually a problem for type 1s. It is usually not a problem for type 2s. We don't get bothered with it so much, but type 1s do, and you have to check for that every so often. And if you do have the ketones in the urine, then you check and go to the hospital or call your doctor immediately. Now, and I've got it listed here. The body doesn't have enough insulin, and because of the fact that the pancreas is shutting down, so the muscles don't get the glucose they need, and the body breaks down fat for energy, and as a byproduct of that, you have ketones, and they poison the blood, and the glucose goes into the urine, and you get really dehydrated, and you can go into coma and shock. So if you're type 1, you'll know about that. If you're type 1, your doctor will already have talked to you about that. Signs of DKA, signs of diabetic ketoacidosis: a lack of appetite, stomach pain, vomiting, being sick to your stomach, blurry vision, a fever, you feel warm, you feel dry, you have flushed skin, it's hard to breathe, you feel weak, you are excessively sleepy, and you have intense thirst, a dry mouth, frequent urination, and a fruity odor on your breath. Now, some of these symptoms are symptoms of diabetes anyway, but they are present if you have ketones in your urine, and that's a very, very serious situation. I can't tell you enough how much you need to get medical care for that. Okay, so let's go into some other information on diabetes. I'm going to review with you what the symptoms are, and we'll go on from there. This is just going to be a quick review, and I have other information here for you. Signs of diabetes, to begin with: if you're tired, thirsty, you crave extra liquids, usually that's more than 10 glasses of liquid a day. Frequent urination, especially at night, always hungry, especially after eating a meal. If you are eating a meal and you should be full, then suddenly you're hungry again. It's because your cells are starving. They're not getting the sugar that they need. What's getting it? Well, it's sitting in the bloodstream. There is a term you may have not heard of before, and it's called grazing. I remember when I first heard the term, I was with my diabetic educator, and she says, "Do you graze?" I had no idea what she was talking about. But grazing is when you are continually nibbling, continually eating. And what happens is, you go from one thing to another. Yeah, I'll have a cup of coffee. Well, that's not enough. Here, let me get this cookie. Just a couple of cookies won't do any harm. After you have the cookies, well, what else can I eat? There must be something here I can eat. I'm still hungry. And so you eat and eat and eat. That's called grazing, constant eating. You have unexplained weight loss. I lost 30 pounds in 6 weeks. And I thought, gee, it is so easy to lose weight. I don't understand why people have a problem with it. And I went to one of my doctors who I saw every so often, and I says, well, I've lost another 4 pounds this week. It was so easy. Why do people make such a big thing out of losing weight? There's nothing to it. And all of a sudden, something clicked with him, and he says, oh, really? You are going to a doctor. He was not a specialist in diabetes. So you are going to a doctor, and you're going to find out if you are diabetic. Or he didn't say that. He said, there may be something wrong. You're losing too much weight. You're losing it too fast. You're not even trying to lose it, and you're losing it. So let's find out what's going on. And I went to the doctor and was diagnosed. Blurred vision is a sign, numbing and tingling of the feet is a sign, and wounds that do not heal. And all of those can be signs of diabetes. Also, infections. With me, it was always foot infections, vaginal itching in women, sexual dysfunction. Now, the treatment plans are going to include medication, pills, that would be insulin and pills, and diet and exercise, which we're going to now go into. I wanted to start something here on nutrition. And I want to talk about meal planning first. We'll have time to do part of this, but we won't finish it with, so I'll have to continue with it next time. You need enough glucose to meet your energy needs. And you need to have meals that include protein. Protein will come from milk, and you need 2 or 3 servings of milk. Meat and meat substitutes, 2 or 3 servings. Now the meat, obviously, you know what that is, hamburgers and hot dogs and stuff. But the substitute would be eggs, cheese, fish, things like that. Then you need carbohydrates. Vegetables give you carbohydrates. You need 3 to 5 servings. Fruits will give carbohydrates. You need 2 to 4 servings. Breads, starches, pasta, things like that, 6 or 7 servings. And the fats, very small amounts of fats. I'm going to show you now the triangle, the food, what's called the food pyramid. Now, this pyramid has changed, so it's not exactly the same as it was, but you need, if you go from the bottom up, breads, cereals, rice, and pasta, 6 servings. Always check your serving size. And the reason I say that is that if a serving size is 1/3 of a cup, it doesn't look like a lot to you. So you say, well, a little more won't harm. So you may be taking 2 or 3 times the amount that a serving has. So this is all based upon what the serving size is. Bread, cereal, rice, pasta, 6 servings. Vegetables, 3 to 5 servings a day. Fruit, 2 to 4 servings a day. For all of this, that seems kind of high on the carbs, but this is what the pyramid says. 2 or 3 servings of milk, 2 or 3 servings of meat or meat substitute, and fats and sweets, very limited. Some, but not much. That is the food pyramid. Now, let me get some more up here. Okay, meals should be 4 or 5 hours apart. And the insulin, because the 4 or 5 hours apart, is because insulin needs to work with a meal before you have another meal in which you have another dose of insulin to work, so you don't get it mixed up. So 4 or 5 hours apart. Don't go without food for more than 5 hours. I know I've done it. If I get working on a project, if I'm busy, I just don't think to eat. And I keep going, and then suddenly my head feels a little funny, and I check my clock, and I've been maybe 7 hours without food, all because I'm busy. Now, 50% of your meals should be basically carbohydrate: fruits, vegetables, bread, and cereals. And 1/4 of your diet should be protein, which includes meat, eggs, milk, cheese, fish, that kind of thing. So 50% on the carbohydrates and 1/4% on your protein. As far as fats are concerned, monounsaturated fats are simple liquids like canola oil and olive oil. Olive oil is supposed to be very good for your heart. Polyunsaturated fats are complex liquids like corn oil and safflower oil. Saturated fats, which are really quite bad for you, are solid at room temperature, but that means butter and a lot of it in red meat. You should not have much of your saturated fats. Cholesterol is a waxy fat that's used by the body, and it helps to build cell walls, and it helps to produce vitamins and hormones. You need some cholesterol, but the cholesterol is produced by the liver, but it also comes from animal products. A lot of the cholesterol, when you say you have high cholesterol, it's made by the body itself. You can be very careful in terms of your diet and still have high cholesterol because your body is producing it. Glucose is a simple form of sugar. It's produced by breaking down of food in the digestive process. The sugar that's in the blood is called glucose. It's just another form of sugar. Sometimes I use the term sugar, but glucose is the correct term for what is in your system as sugar. Now, when you buy food, when you buy groceries and so forth, I've blown this up, there will be on the back of the package somewhere a list of what's in it. It'll give you the calories. Calories are just the amount of energy that you get from the food that you eat. So you have the calories. You have to watch your serving sizes. The serving size will be listed. How much is a serving size? A cup of cereal, a half a cup of vegetables, whatever it is. Go by the serving size. You'll have the calories. You'll have trans fat, I'm sorry, total fat. It'll give you the percentage, it'll give you the amount of grams a lot of times. Your carbohydrates, sodium, potassium, and so forth is in there. Then you're likely to get a list of vitamin content, if there is vitamin content. I'm not going to go over this list, but it'll give you the percentage. I'd rather have it give the grams, or the units. If I'm taking vitamin E, I'd rather have it say 25 units. International units, which is what vitamin E, how they register it, rather than say it's 10%. That doesn't mean so much to me. Then you get the mineral content. I've blown this up. What you need to look at, you want to know the protein that you've got, which is right here, 3. This is from a cereal, only 3. The sugar you don't have to pay any attention to, except if you're curious to know what is in it, because the sugar is already counted into the carbohydrates. To find out how sweet something is, look at the carbohydrates, because the sugar will be in the carbohydrates. Then you want to know what your cholesterol is. Usually trans fats, they don't have anything. It's very serious. They've taken trans fats out of food, so you don't have to worry about that. But it's usually listed, and it's listed as 0. Now, I'm going to stop it here because we are almost out of time for this segment, and I'm going to continue with this next time, and I will finish with the nutrition, which I have a hesitation talking about because your nutritional needs depends upon your condition and upon whatever your complications are. But I'm just giving you a general rule of thumb of what the general nutrition is that should be. But don't think that this is advice that you must have this or you must have that. You need to talk to your diabetic educator to know exactly what you should have and how much. This just gives you a rule of thumb and a general information to go by. So I'll close it here, and we'll do this again next time. Please join me then.